So a very warm welcome to everyone. I am Dr. Sakshi Bhatia and I am the occupational therapist. I've been working for a while now with the kids who are having difficulty, with our sweet little kids. They teach us so much, I feel. And I have been using this sensory diet as a tool in my practical treatment approach. So I've been practicing this a lot, and I have seen a tremendous changes, or I can say tremendous development improvements in the kids when the parents, they follow this diet at home religiously. So yeah, it's a very important tool which we follow over here almost all the times, and I always recommend all the therapists, no matter what, only OTs, but speeches and special educators, behavioral therapists, they can also follow this, and it's going to make their sessions go fantastically, because it really helps. It really helps our kids out. Okay, so yes, thank you all for joining us, and thank you Autism Connect for organizing such a wonderful platform where parents and we professionals can connect with each other, and I feel it's a very wonderful initiative taken by them. So kudos to all of you, the entire Autism Connect team. So let's quickly begin. So the topic for today is sensory diet and how do we use it at home. All right, so I'm going to make it very simple for you guys, because over the period of time, I feel that for the things or the medical terms which we use as a professional, because we are from medical background, it's very difficult for the parents to understand. So then I learned that, okay, I have to simplify a lot of things. So again, in this talk, in this session, I'm going to make it very simple for you guys to understand. And I'm assuming and hoping that by the end of the session, you will be able to relate and you will get few ideas so that you can follow the sensory diet at home. So I have divided this in a question answer format, so it's going to be a little easier for you. So coming back to our first question, that what is sensory diet? So sensory diet is all about the food for the brain. That's a very simpler statement which I usually say, that it's a food for the brain. So we all have heard, and I'm sure all of us through social media, we are aware of so many diets. There are weight loss diets, there are weight gain diets, keto diet, then vegan diet, etc. So what do all these diets do? They transform our body, right? The way we desire that, okay, I want to look this way, I want to look that way. So they transform our body. But on the other side, when we are talking about sensory diet, it's completely different from all these diets which I mentioned earlier. Okay, so this is basically the diet for the brain, the food for the brain. But that doesn't mean that we have to prescribe a food. No, there are no food items. Basically, these are the signals which goes to the head, and it organizes our head, organizes our brain. It helps us to maintain more regulation. Regulation means all being calm. Okay, it helps us to be more organized. It helps us to understand that how to proceed further. Okay, so this basically, I can say it's a food for the brain. It transforms our brain. It transforms our thinking. It helps in our growth. It helps in our development. It helps in our alertness level, attention, and all these things are required to respond back, right? If somebody is calling you, or if somebody is asking you, you have to have your brain in the senses that you are able to reply back, right? So this is what sensory diet do. Okay, so first question was, what is sensory diet? The answer is, it's a food for the brain, which helps us to transform our brain for our better development. Okay, coming back to the next question, that is the second question, who prescribes sensory diet? So the only professionals who can prescribe sensory diet is occupational therapists. A certified occupational therapist are the only people who can help you out to customize the sensory diet based on your child's sensory need. Okay, and no other therapists are allowed to make a sensory diet plan. So basically, it's been prescribed by an occupational therapist. Now, coming back to our third question, that we've been talking about diet. It's not a food also. So how do we manage? How do we make a sensory diet, or what do we do in sensory diet? So I am going to give you examples, because it completely depends, as I said, about sensory needs. Now that senses, sensory needs, etc., these are again a very, very huge topic to explain, and definitely that we will not be able to do it over here right now. So I'm going to give you a few examples where you can understand how you can customize the sensory diet plan for your child based on their sensory needs. Okay, so a lot of times parents, they come to me and they were like, when it's a time for haircut for my child, it's a night. My child doesn't allow haircut. My child doesn't allow hair wash. My child will not be okay with the clothing of the texture. So every time we have to make sure that the same clothes, same texture clothes only I have to give, and nothing else, because otherwise my kid gets very angry, or my kid gets very sad, or throw tantrums, etc. Gets into aggression, etc. So these are the signs of sensory defensiveness. So when we talk about defensiveness, that means that child does not like it. So it, as I said earlier, that these are the signals which goes to the head. So when the child is sensory defensive and he hates haircut, and when the haircut time is there, so the signal will go to the head in the child's brain that, it's a haircut time. I don't like it. I hate it. I am not safe. I'm not comfortable. Whatever you want to do it, but I'm not gonna cooperate. So these are the things which happens, which are running in the head. That conversation is already, this parallel talk is already happening in the head via a signal which is going, and which is the situation what is happening, like the haircut. Okay, so then in that case, the anxiety builds up, the child throws tantrum, the child gets angry, he will start crying, parents will be more upset that, we are not able to manage. So in such situations, I usually recommend TheraBrush. So this is called a Thera pressure brush. I think you guys can see. Yes. So this brush is very, very important, and it's a part of sensory diet. So usually when I tell parents that this is required and this is very important, they'll be like, how this brush is going to help? This looks like we can wash clothes with that. No, it's not that. It's generally very, very helpful, because the bristles which you can see over here, it stimulates the nerves. It stimulates the nerves, in an easier term, means that a signal is being sent to the brain that it's okay. I understand that it's haircut time, but everything is going to be fine. It's going to be easy. You are safe. You have to give time to it. So this parallel talk is going to happen, and this will calm your brain down. And that's why it's a part of sensory diet. And that's why I said in the first answer that sensory diet helps the brain to regulate, helps the brain to be more calmer. All right. So these are the things which we use. So this is called Milberger's protocol. The only thing which you have to keep in your mind is that do not use this without consulting your therapist. Because to follow this, there is a strict protocol, and only when your therapist is telling you that you have to use this, you have to ask the strict protocol how to use it, how many times you have to use it, and then only you follow this. Please, it's a humble request. Do not follow this all by yourself. You need guidance to start doing the Milberger's protocol. So go ahead, check with your occupational therapist. They will help you out to plan how to use this, when to use this, and the frequency of this. That means frequency means that how many times you have to use this. All right. So this is one of the examples. That child was very, defensive. Defensive means he was avoiding, he was not liking it, he was hating it, and he was scared, he was anxious. So we can use this is a TheraBrush which we use. Another thing, when parents come, so I'm telling the common issues what parents come with. So then I think it's going to be easier for you guys to relate, because otherwise, as I said, it's a huge topic about all the 8 senses which we have, and definitely due to time constraint, we may not be able to continue with that. All right. So another issue which I keep hearing, that parents come and they say that, oh, my child is very scared of the loud sounds. He immediately closes his ears like this, and moment that there is a cooker whistle at home or any drilling sound, he gets very anxious, he gets very scared. So at that point of time, what we can use is, this is a kind of pop-up tubes we can use. So now this, you can hear the sound also. I'm pulling this, it's making sound, and I'm gonna put it back, and it's a fun activity. And that's why I think I like my profession so much, because it's so much of fun, so much of play which is happening. Along with that, the kids also feel safer. Now, this is something which will help in them to overcome their sensitivity towards the sound, right? So it is making the sound, it's fun, it's play-based, and there's going to be okay with that. All right, another thing which we ask them to use is, which I ask them to use is, use of the headphones. They can put the headphones, the music will be on, and that's a program called Therapeutic Listening Program. That is also a part of sensory diet, which we recommend if the child is having auditory. Auditory means sound related difficulties. You can use that, and you will see in a couple of sessions, they will be able to overcome the sensitivity of the sound. All right, so these were the two issues. Another issue which I keep hearing based on the touch beans. Touch beans is tactile beans. So parents will come and they will say, my kid doesn't like to touch wet things, or my kid doesn't like to eat all by themselves because they do not like the touch of the food, or probably sometimes when they touch it, they feel very pukish, they gag on it. So what do we do? So there are so many other things. I ask them to use different kind of textures. These are the easy available things which are there at home, and therefore I'm showing it to you. This can be foam. You can do a lot of foam play. This is a normal shaving foam which we use, and you can do a lot of shaving foam play. This is water beads. So I am not sure if you're able to see it, but these are the jelly kind of beads which you can soak in water, and then it grows up and you can actually break it. You can have fun with it. So the entire point is that if your child is having difficulty, you have to make it very, very fun, very, very play-based. Then only you will be able to address their sensory issues, and the sensory diet has been customized only in that way, so that the child will be able to actively participate in that, and therefore they'll be happy. They'll be able to do all the work rather than being very anxious, rather than having tantrums, or not being so cooperative, etc. All right, so these are the things which we use. This is another sensory diet equipment which I recommend to all the parents. This is called Therapeutic. Now, this is very, very calming, right? So it looks like a Play-Doh, but it's not a Play-Doh. It's not the Play-Doh which you get commercially in the stationery shops, etc. This is not that. Sorry, this is one. So this is Therapeutic. It comes in each several kind of resistance, I would say. Resistance is basically, in easier terms, known as the tightness of it. So this one is not so tight. The black one, it has different colors. So the black one is very, very tight. So when you fill it, you will feel very calm. Now, see, even though I'm talking to you guys and I'm still doing it, it's giving a very calming effect. And that happens with everybody. So a lot of times, I'm sure, a lot of times and a lot of people will like to, burst the bubble wraps or play with the bubble wraps. Yes. What does that do? That helps us to be more calm, more, organized, etc. It's just like you're doing it, you're feeling relaxed, right? So this is Therapeutic. We can do a lot of activities with Therapeutic, and this will help in their touch-based difficulty. Now, this is something which you will get everywhere. This is again a fidget toy, pop-up fidget, and we keep popping it, and then we can talk also. Your anxiety will be better. So now we are talking a lot about anxiety. That is there in everyone. It's not only the kids who are diagnosed, they are having anxiety. Everybody have anxiety. And this sensory diet is being used by everybody. So now coming towards the next question, that who requires sensory diet? So sensory diet is being required by everyone. Me, you guys, everyone out there. Diagnosed, not diagnosed, everybody. Because as I said, This organizes our brain. This helps our brain to be more in a regulated fashion. That is being more calmer. So now what happens with us? It is happening automatically. Now, for example, if you are in some meeting, okay, and your attention is wandering somewhere, you are not there, you're feeling sleepy. So what will you do? You will try fidgeting with something in your hand, probably the pen, or you will start twirling your hair, or you will start rocking. So what are you doing? You are actually getting your attention back. That, hey, attention, please come back. You have to focus over here. We have to focus what the speaker is telling. What is he or she is asking? We have to reply back to them, right? But so that is very automatic with us, right? But with the kids, what happens is they are like, it doesn't make any sense to me. Why should I get my attention towards you when you are calling or asking me to do something? Because it doesn't make sense to them at all. So for them, we have to provide these sensory diets, these kind of activities, which will help them to focus more, which will bring their attention, which will draw their attention to the speaker or the therapist or the parent or any individual who is asking something. So this, and that then only they will be able to respond better, right? So if they are organized in their head, then only they'll be able to respond, because then they are listening what you are saying. Otherwise, it's like, oh, I am lost in my own world. I do not know what you are asking. So I'll conveniently, not reply to you. So that's what happens most of the time with the kids, because they are so preoccupied in their thoughts. They are so lost in their zone that a lot of times when parents say that, oh, there is no name call response. These are the technical things which we always listen from the parents, and complaints basically. So they say that my child doesn't listen to me, and the name call response and all that, because that's not making sense to him. He is already in his zone. So to draw his attention back, you have to do so many things. You have to incorporate sensory diet in your day-to-day living, so that they are going to be more organized. One of the very interesting activity which I use is the bubbles. Okay, when the child is not looking at you, let's try blowing the bubbles, and then you see the reaction. At least he is responding back. The back and forth interaction is happening, and that is very important. So somehow I feel that when you provide all these things, the child will be happier, and then there will be not many tantrums. Definitely there will be few tantrums. I'm not saying that it's a magic thing and there will be no tantrums at all. It's going to take a little while. It's definitely going to take a little while, but it's going to get better. It's definitely going to get better. But I feel very sad that sometimes when the child comes for the therapies, and the parents have that expectation that the entire session should be very robotic, very monotonous, that this activity they have to do. And even for the therapist for that matter, they'll be like, oh, these are the things which we have to do. Somewhere the play is missing. Why? The child requires play. The child, see, the occupation of the child is to play. And more they will play, more and more they will move, they will learn, they will definitely learn. Their anxiety will be less, they will be much more calmer, they will listen to you, they will respond back to you. So I feel it's more about the play which you have to incorporate along with your sensory diet, and you will see tremendous changes, improvements in your child, and there will be less of tantrums, they will listen to you, and it should be fun. It should be fun. And that's the reason I like my occupation as an occupational therapist, that it's so much of fun. I actually play with kids, and they also like me that we play so much. So it's so much. I was showing you about the Therapeutic, that, oh, it's making a sound. Oh, it's gone back. So now in this activity itself, there are so many skills which are happening. You are using both the hands. You are doing, that is called bilateral integration. As I said, I'll use less of medical terminology and I'll use a lot of layman terminologies. So this is bilateral integration, I would say. That means using both the hands together. You're putting pressure and taking it, pulling it back, and pulling it back again. It's making sound. Oh, it's making sound. And this will help in their writing skills because it's a fine motor skills. You need your fingers, you need your hand to write. So with one activity, a lot of areas will get covered. You just have to plan that way and you have to be more playful. The child should be very comfortable. Another thing, I use a lot of lights. Lights are something very magical. So usually when I prescribe sensory diet, there will be a lot of tactile based, touch based activity, as I showed you, the water beads, therapeutic, foam, TheraBrush, then the sound based activities like the cube, which I have shown it to you, or the headphones. Then there will be a lot of fidget toys. These are called fidget toys that you keep doing it and you will be relaxed. Your hands are engaged, your attention is there. Lights are something which is very interesting, which I can show it to you over here now. So I think, can you see that? I don't know if you can see that. Okay, these are the kind of lights which you can see. All right, so this is also very calming, very calming, that, oh, it's moving, love that stuff. And you can build such a good interaction, communication skills in that. So you just have to plan it out, and please check with your therapist. They can help you out with the sensory diet plan because it has to be customized based on your child's need. There are so many senses I was talking about: the touch based, the movement based, the sound based, the visual based. So based on your child's need, your therapist will be able to customize the plan, and you have to try that religiously every day, and it's going to be very helpful. Now, the another question comes that, how many times and for how long do we have to give a sensory diet? Now, this is something which again, it's very easy for me to make you understand that, as I said, that it's a food for the brain. Now, for our body to function, we eat 3 meals in a day, right? Breakfast, lunch, dinner. So it's not that today I had 3 meals, then for an entire week, I will not have anything. Or for an entire year, I will not have anything. No, that's not possible, right? We need food, we need 3 meals every day in order to function, in order to function in an appropriate way, right? For my growth, for my body's development, right? So same way is for the brain also. You have to provide this every day, which will really be helpful for your brain's development. So it's an everyday thing. So every time, every moment, you have to provide this sensory diet, and that is valid for us also. Now, what is happening in us that, okay, imagine that you had a very tiring day, all right? You all came back home and few people will like, okay, let's go for gymming, exercise, right? A lot of people, they do that. They will be like, okay, the movement is happening, their brain is getting calm. Few people will be like, I personally like the soothing music. So I come home, I put speakers on and I put a soothing music. So that regulates my brain. Sometimes I also do come back and I'll be like, oh, it's a chill day. Let me not do any work. Let me just binge watch Netflix. That is also a sensory break, sensory diet. So whatever makes you happy, whatever makes you feel happy, whatever makes you feel comfortable, and your brain is focused and calm and organized and regulated, it works. It works. So every day we are also getting sensory diet, and same is with the kids also, that we are getting, we have to provide them sensory diet because at this age they do not know. So we have to customize the plan and we have to give it to them. And with practice in their later ages, they will be able to help themselves out by understanding, okay, this is my requirement, I have to do this, or this is not my requirement, we have to do that. So that's the way sensory diet works. And it's really helpful for all the kids. And it's really fun. It's really fun. So please do check with your therapist that how we can plan a diet for your child, and based on definitely their sensory needs. Few things will work, few things may not work, but that's again, it's more about the trial and error, which you have to do it. Your kid may or may not like it. So with practice, it's going to get better. And there are times when the kids, they do not like it, then you have to go gradually. You cannot just pounce on the child and you'll be like, no, you have to do it. You cannot do that. You cannot force that. So 5 main criteria which I always say while planning a sensory diet or while giving a sensory diet is, first is the child should be very calm. Child should be very safe. Child should be very comfortable. You should not force the activities. No forcing at all. The another thing is start of the activity, and the fifth thing is the stop of the activity. So when all these 5 things work together, all is set. Your child is set, he is happy, you are happy, everything goes well, right? So child should be safe, child should be comfortable. You should not force anything. You should not force anything. And the child should know the start and stop of the activity. Now, talking about the start and stop of the activity, why it is necessary? Because it helps in the transition. Now, there will be a lot of times when parents come and they say, my child likes swing and he keeps swinging for hours and hours and hours. And if we ask him to come back, he throws a tantrum because he's getting it for that time only. He will be like, okay, if I'm going to go back, they're not going to give me back again. If I'm going to go back to home, I don't know when I'm going to come back next for the swing, because that is the requirement. And then therefore there is no stop, right? So start and stop is very, very important, which the child will gain trust in you. Then automatically they will stop. You should always give a preparation time for them that, okay, after 10 counts, let's stop it. And then we're going to come next time. So they will have trust in you and they will definitely listen to you. You can also use timer. Timer works magically with the kids. You can put 10-second timer. You can put 15 seconds timer. Start with seconds. I'm not saying the minutes. Start with seconds and gradually increase the time, right? So you have to see that the child should trust you. Start and stop will really help in their transitions. Transitions is nothing. It's just a change from one activity to the another, change from one environment to the another, change from one place to the another. If they will have trust in you, they will definitely listen to you. It's there are times when it's a bad days for the kids. That's completely different. But most of the time they will have faith in you and they will listen to you, and it's going to be a little easier. But you have to follow this religiously and you have to have patience. So please go check with your therapist. Remember about the 5 points which I said, and it's a food for the brain, as I already mentioned, and it's an everyday thing which you have to give it to them. It's like 3 meals in a day. Same way you have to give this food to your brain so that the brain gets transformed and the development happens faster, right? And another thing which I want to mention again, TheraBrush, please do not give it without consulting your therapist. Only your therapist, occupational therapist, can prescribe this, and they will tell you based on your child that for how long you have to do, how many times you have to do, etc. So because it's a very strict protocol, so every now and then I'm telling you about that please check with your therapist. All right. So yes, I think I have covered almost everything. I have shown you a few things. Now, one thing which I think I forgot to mention is about the movement. So when we are talking about sensory diet at home, in movement, what you can do, there are a lot of times parents come and they say that my child doesn't sit at all. So we have to force them and make them sit. We have to force them and then we make them sit. No, it's a big no. It cannot happen. That was the 5 things which I mentioned. You cannot force your child. So that says that your child requires movement. Why can't you put movement-based activities in your sensory diet? Like you don't even need swings or trampoline, etc. If you have it, well and good. If you do not, then a lot of things which you have at home, you can customize in that way. I use a lot of pillows, cushions, cushion fights. You can bean bags. You can run from one end and you can crash on the other hand. You are providing movement. You are providing proprio. Proprio is all about the perception and pressure and the body awareness, about your body awareness, right? Position, basically, not perception. I'm sorry. So position, so that you can help them out with. So you can do a lot of running, crashing. You can roll on the floor. You can jump on the cushions. All these things you can do. So you can always customize that, and that will be really helpful. So do not force, make a sensory diet which can incorporate a lot of movement based activity, and definitely they're going to get better. But the entire process, do not overstimulate the child, because a lot of times I keep hearing that, oh, my child is very hyper, he keeps running around, and I have asked, my therapist has asked him to jump for 100 counts on trampoline. No, how can you do that? He's a kid, he or she is a kid. 100 counts on trampoline will make them just tired. It's not gonna help them in regulating their brain. That, okay, there is no start and stop again. The 5 rules. There is no start and there is no stop. 100 counts will only make the child tired, and definitely after that he's gonna sit. But next time he will have double the energy, because you are creating a stamina, you're building a stamina over there, right? So no, that's a big no. You have to always remember 5 rules. As I said, child should be safe, child should be comfortable, do not force the activity, start and stop. If you will have these 5 rules, you will be able to manage your sensory diet all by yourself. But then definitely do check with your occupational therapist, and that's going to be very, very helpful for you, right? So I am hoping that I was able to, you guys were able to relate with few things, and whatever I have shown you, you might be aware of it, but you can use it more often. And if you still have any doubts, you can connect with me anytime. So thank you all for joining with us, and thank you Autism Connect, that for creating such a wonderful platform, as I said. And yeah, see you next time. Bye bye.